You know that moment you're trying to comfort someone and the words just kind of tumble out? Don't worry, what you're feeling is totally normal. We've all done it, we mean well. But what if that very common phrase is actually making things worse? Well, that's what we're diving into today. Why normalizing someone's pain can seriously backfire, and how we can find a much, much better way to show we care. I think we all have. When you're really hurting, it's so easy to slip into this dark place, this gut-wrenching feeling that you are uniquely, fundamentally broken. And that feeling, it sends you scrambling, desperate to find some kind of explanation, any story that can make sense of why you're in so much pain. So when we're stuck in that what's wrong with me loop, we instinctively search for a narrative, a reason. And according to the work of psychologist Dr. Russ Harris, which is what we're exploring here, the stories we tell ourselves usually fall into one of two main buckets. And this gets us to what Dr. Harris calls the blame or brain dilemma. It's this internal tug of war in how we try to make sense of our own struggles. It basically forces us to choose between two pretty limiting paths. So on one hand, we've got the blame narrative. You know that inner critic, right? The one that whispers, "This is all your fault. You're just weak. You're a failure." It's an absolute recipe for misery. Then, on the other hand, you've got the brain narrative. This is the medical model, and it says something completely different. Hey, it's not your fault. It's just your brain wiring. And you can see the appeal, right? The brain narrative can be a huge, huge relief. For so many people, finally getting a diagnosis or an explanation rooted in biology feels like this massive weight has just been lifted. It shuts down that inner critic and gives you permission to be a little kinder to yourself. But it's not a silver bullet. This narrative can come with its own set of problems. It can sometimes leave us feeling powerless, like we have no say in our own lives. And really importantly, it can totally gloss over the very real impact of our environment. Things like past trauma, poverty, discrimination, or just being in a terrible situation. So if we're stuck, if blaming ourselves is a dead end, and just blaming our brains doesn't tell the whole story, what's left? What else is there? It feels like we need a totally different perspective, right? And there is. This leads us to a third path, a really powerful one that comes from a framework called acceptance and commitment therapy, or ACT for short. And it completely reframes the entire conversation we have about suffering. This quote, "This is the heart of it all. Just let it sink in." Instead of saying you're broken or your brain is broken, ACT says something so much more profound. It says your suffering is a perfectly understandable response to being a human being in a really challenging world. It's a game changer. Okay, let's break that idea down. The first piece is just accepting a basic truth. Life is hard. I mean, come on. We deal with relationship conflicts, money worries, global pandemics, loss. It's a lot. So feeling difficult emotions isn't a sign that something's wrong with you. It's a sign that you're alive and paying attention. Second, let's talk about our minds. Even when your brain is spinning out, worrying, judging, catastrophizing, it's not trying to sabotage you. Think of it like a really anxious, overprotective bodyguard. Its only job is to try and keep you safe and solve problems. Now, are its methods always helpful? Oh, heck no. But the intention is always protective. The exact same logic applies to our behavior. From the ACT perspective, everything we do, even the stuff that looks totally self-destructive from the outside, makes perfect sense on some level. It's always an attempt, conscious or not, to meet a need, to get something we want, or to get away from something we don't. And finally, emotions. They are not the enemy. They're not a sign of weakness. They are data. They're crucial messengers that show up to alert you to what you deeply care about. They're like a compass pointing you towards your values. They're allies, not something to be crushed or ignored. So the ultimate message here is this. The pain you feel doesn't mean you're defective. It doesn't mean you're disordered. It just means you're human. You're a person navigating a really complex world with a mind and a body that are just trying their absolute best to help you out. Okay, so this brings us right back to where we started. If being human means there's going to be some suffering, then why does it feel so awful when someone tries to comfort us by saying, "Don't worry, that's normal"? Why does that attempt to connect so often land with a thud? Imagine this scene. A well-meaning therapist trying to make their client feel less alone says this classic line. The intention is good, right? They're trying to build a bridge to reduce shame, but the response isn't what you'd think. Wow, this response is so powerful, isn't it? It just perfectly captures how a simple phrase like, "we're all in the same boat," can feel like a total erasure of someone's individual struggle, their unique circumstances. And there are some really deep reasons this happens. Saying something is normal can make a person feel like their pain is being trivialized. It can undermine their unique experience. And for someone who has a long history of being ignored or having their feelings dismissed, well, it just feels like more of the same hurt. Honestly, the word normal is just a landmine. It's so loaded. When you say it, what the other person often hears is, your specific pain isn't that important. It's just like everyone else's. It accidentally erases their individual story. So, what do we do instead? What's the solution? How can we actually validate someone's experience without falling into that normalization trap? Let's look at a practical toolkit for doing this better. Okay, so on the left are the phrases we should probably try to retire. That's normal, we're all in the same boat. But look at the options on the right. Instead of normal, try saying, that makes perfect sense, or that's completely understandable, or of course you feel that way. Can you feel the difference? These phrases don't minimize the pain, they validate the reason for the pain. And that's the core principle. The goal needs to shift. We're not trying to convince someone their pain is common. We're trying to communicate that, given who they are, their history, and their circumstances, their pain makes sense. It's about deep understanding, not just filing them under a label. And that leaves us with one last thought to take with you. The next time you feel that familiar, painful pang of, what's wrong with me? I want you to try and pause, and then ask yourself this question. How could you see this struggle, not as proof that you are broken, but simply as proof that you are human?